Hello, everyone, and welcome to today's webinar, Green Cleaning, Improving Cleaning for Health in 3 Easy Steps. I'm Ann Cosgrove, the Editor-in-Chief of Facility Executive Magazine, and this webinar today is presented by AirMax Professional. Before we get started, I would like to cover a few housekeeping items. Please note the control panel that is on your screen. This is where you can submit questions in that question box in the panel. You can send your questions in at any time during the presentation, and your speaker will address them afterwards. Also, please note the orange arrow on the left side of that control panel. Clicking on that will either expand or collapse the control panel, so please be sure it is expanded so you can access the question box. Also, if at any time you experience a technical difficulty, please send a message to us in that question section. Now I'd like to introduce your speaker today, Jeff Dreifout. Jeff is Global Director of Marketing of Air Treatment at AirMax Professional, and over the past 20 years, Jeff has served in various marketing and innovation leadership capacities in organizations such as Quaker Oats, Conagra Foods, Sara Lee, and now Fellows. An MBA graduate of Pepperdine University, Jeff also serves as an adjunct professor at his alma mater, Trinity Christian College, and he serves on the school's Business Advisory Council. Before handing it over to Jeff, we do have a quick poll question for you all. So please take a look at your screen. The question is up there now, and take a moment to cast your vote. The question is, which of the following best describes why you are most interested in green cleaning? Is it for the environment, for the cost savings, or for the health of your occupants and staff? Please take a minute, and we will show the results shortly. Okay. So the results will pop up here. Here we go. 62%. You're interested in green cleaning because of the health and occupants of your staff. That's followed by a little over a quarter for the environment, and cost savings came in last at 10%. So thank you very much. And with that, I'm going to hand it over to Jeff Dreifout. Jeff?
Great, thanks, Ann. And hello, everybody. Good afternoon. I hope everybody is doing well, and thanks for joining today's webinar. I'm going to spend a little bit of time talking today about green cleaning and how we can connect cleaning to health in 3 basic steps. And so without further ado, let's move forward. Our learning objectives today are quite simple. Is first of all, why do we clean green? Thank you for your poll there. It's great that we're hearing that most people here are saying, I'm looking to clean green for the health and well-being of the people within the building. So it's really people first. Associated with clean green, and we'll get into that a little bit more. There's a basic 3-step implementation plan that we're going to recommend as it relates to how to clean green within your organization. And then lastly, I'm going to give you really some value-added information here and an idea about how to really take cleaning for health to that next level, something that has a direct implication to the health and well-being of people within a facility, and it's probably something that is being ignored or not being addressed today in your facility. So we certainly want to share that with you. So with that, these are the 3 that we're going to go over today. So first and foremost, why green cleaning? Why is it something that we even think about, and what would even the benefits here? But first of all, and you guys really affirmed this in the questionnaire, is the fact that it's about people, right? We clean. First of all, we clean because of people, and we clean green because of the health and well-being of the people. We also do it because of the environment, and it's very interesting. The polling here is aligning directly to these 3 pieces. It's first about the people. It's also about the planet. Clearly, we don't want to do anything that is going to negatively impact our environment. And then lastly, from a cost standpoint, we do it because not only it's right for the people, it's not right for the environment, but it's also right for financially. And if it can make financial sense, it's really the trifecta here. So those are really kind of the 3 key areas of why we're focused specifically on green cleaning. So really, what is green cleaning? Many of us probably have different perspectives and interpretations of what this can be. But very simply, and the way that we look at green cleaning is cleaning for health without harming the environment. And I think what's interesting about this statement is the real focus here is about cleaning for health. I think historically, green cleaning was more about having kind of the environment focus on it, right? And I think there was probably a little bit more of a tree hugger type of dynamic to green cleaning, and that's really not the case. It's really evolved and morphed it in such a way where you don't want to negatively dilute the effectiveness of cleaning, because we know how important that is. So we want to clean for the health, but we want to do so in a responsible way. So these green cleaning programs that are around are indeed focused on using environmentally friendly products and processes, and they help maintain the health of the occupants. So that is key. It's good for the health and good for the environment. But to be effective and to clean in an effective way, we also want to make sure that it does not only doesn't hurt the environment, but it also can positively impact the environment that you're creating as well. And so I think that's kind of an interesting dynamic here. It's maintaining the health of the building and the occupants, not doing any damage to the environment, but actually creating a positive environment that you're cleaning. So that's how we're thinking about green cleaning and how you'll see it through the rest of this presentation. So why green cleaning? Why are we even focused on this? We hit upon this earlier, but first and foremost, we live here. We live on Earth, right? We have a responsibility to make care of our environment. And this is something I think that obviously has been a growing consideration, is really kind of an ante now. It's something that we all need to continue to focus on, not only here in the US, but globally as well. The second piece of it is why green clean is we spend a lot of our time indoors. About 90% of all of our time is spent, inside. That can be at work, school, in your home. But a clean environment is pretty critical, just because of the amount of time that we spend there. And then also, we all breathe, right? That's the easiest piece of research I've ever conducted in my life, right? So we're all breathing in. It's something that is just one of the pillars of our life. And the role of air within green cleaning is just really important. And so to that end, we kind of look at these three things and say, hey, we live on Earth. We want to be respectful of the environment. We spend a lot of our time indoors, not only us, but our kids, our employees, our vendors, our partners. And the fact that we're all breathing in is key. And so anyone that's walking into our building or into our facility is taking in and consuming the quality of the air that we are putting out there for them. Okay, so our daily consumption, why green cleaning? Well, we look at it this way. Let's go back to that kind of pillars of life, right? So water, right? So on average, Americans drink about 2.5 cups of water a day. We've kind of evolved to bottled water. Filtered water was something that really wasn't around, 20, 25 years ago, and it's commonplace today, right? It's all about getting the purest water, getting the impurities out of the water so that we can have water in the state that it's meant to be consumed in. Food, right? We eat about 5 pounds of food a day, and so we certainly our brand choices, our food choices, the amount of food that we eat, carbs, protein, fiber, whatever. All these different pieces, we put just such a huge amount of consideration into, because both water and food are things that we consume. And we know directly that if we consume healthier foods, we're going to feel better and we're going to have better wellness. On the other side, if we're consuming water, we're consuming food that really isn't that great for us, that's going to have a direct correlation to our health. But, food and water are just two pieces of what we need to live on. What about air? And here's the insight. We actually take in 3,000 gallons of air a day. And what's interesting is that's involuntary, right? Clearly, we're just breathing every single day, and the volume of air that we're taking in is really unbelievably large. But what's interesting is, do we think about air in the same way that we think about the purity and the quality of the water, the purity, quality, and the healthiness of food? And I would say we don't. And this is a really big opportunity for us, because the quality of the air, like with water and food, has a direct correlation to our health. And it's something that we're not thinking about today. With water and food, we can make individual choices, right? We can select that. But with air, as we walk into a building, we don't have a choice, right? We have to breathe in that quality of the air that's there. Let's make sure that the air that we're breathing in is critical, is pure, and it's a quality air that for the environment. So why green cleaning? Here's the other insight. Indoor air is more polluted than the outdoor air. That's something that many people really don't really realize or know. The indoor air can be up to 2 to 5 times more polluted than the outdoor air. Now, the outdoor air is really what gets most of the press, right? You hear about outdoor air pollution. You can see the smog. You can see pollution, things like that. But indoor air is more polluted because, one, you bring outdoor air in to a facility, but also all of the air that's inside really kind of gets trapped in there, right? As soon as you introduce multiple numbers of people, you introduce materials, you introduce electronics and equipment and things like that, all of that pollutes the air that we're in and contains it within an environment. So again, I'll go back that 90% of our time is spent indoors, and most of our time is actually spent in what we call shared spaces, and that's a space that we're sharing with others. So you may be sitting in a conference room right now with somebody else. You may be in a classroom, things like that, but you're sharing the air with others around you. Okay? So to that end, well, what's the big deal? What's in the air? My air seems like it's fine. Well, that's the case if you can detect it, right? But what's in the air generally are things we can't detect. Bacteria and viruses. Many of the reasons why we get sick is because we're inhaling in bacteria and viruses as a respiratory illness. So that's a big issue. We're also breathing in allergens, pollen, ragweed, mold, pet dander, dust mites. For those of you who are allergic to certain things, you know how miserable it can be when your body reacts to an allergen. Well, we're breathing in that allergen. That pollen and ragweed is in the air. If you've ever looked through a window, the sunlight kind of peering in through a window, and you can see, the particulates floating in the air, that's probably dander or dust mites that's there. So you really can't see it with the naked eye, but it's absolutely there, and you're breathing it in. VOCs, this is volatile organic compounds. These are things that are emitted off of objects that might be in your building. So it could be the paint on the wall. It could be a copier, a fax machine. It actually could be the cleaning chemicals that is used to clean your environment could contain these VOCs, and those are actually irritating the eyes. They're giving you headaches. They're making you nauseous. And so if you have people within your building that are commonly complaining, it may be because of a VOC. The one that's in the air that we all know about certainly is odor, and this is a detectable one, right? So the first three zones here, bacteria, allergens, and VOCs, we would call these non-detectable, things that are in the air. Odors are detectable. So, some people may say, falsely so, that my air is fine. But the issue is, how do you really know? Because you've got all these things that aren't detectable that are in the air. All right? So, green cleaning for health. We talked about the role of cleaning. And the U.S. has almost 3.5 million cleaning employees. And what are they doing? They are using a lot of chemicals. Over 6 billion pounds of chemicals are used to clean commercial buildings. That in of itself is such a large, massive number that we need to know that what they're clean, the quality of the chemicals that are being used are not doing any harm, right? And so a couple things is making sure that those chemicals are VOC free, but then secondly, the less chemicals that we can use, that's better for everybody, right? And so that's something that I think we just have to certainly take note of. And those chemicals are coming certainly at a high cost as well. These chemicals do have an effect on us, right? As was mentioned before, many of these chemicals, cleaning chemicals, have VOCs, which can, make you, can actually give an allergic or an asthma trigger. They also can contribute to sick building syndrome as well. In addition, there's a direct correlation to some of these cleaning agents to some incidences of types of cancers. So again, we don't know, and I don't know what kind of chemicals being used to clean my area, right? And I would ask the same of you guys as well. This is something we certainly need to be conscious of, and typically we haven't given, a thought. So why Green Clean also is, many schools are actually incented on absenteeism and graduation rates, and we know that there's a direct correlation between absenteeism and test scores and even graduation rates. So that's taking a school example. Taking a business environment, I would say that there's a direct correlation between absenteeism and productivity and costs and healthcare costs as well. And so in two different examples that I'm referencing here, School A implemented a green cleaning program and saw 24% reduced illnesses, 4% reduced doctor's office by children, and a 46% decrease in student absenteeism. And talking with student administrators, the first and foremost thing to do to improve test scores is to have children present, right? Get butts in the seats, as they call it. The other school implemented a green cleaning program also and saw very similar results, a 52 decrease in dust indoors, less VOC, 40% decrease in bacteria, a 61% decrease in fungi colony forming units. So again, these are significant improvements to many different things that we might not be thinking about today, but are having a direct correlation to the presenteeism and the ability for students, workers, and staff showing up to work and not getting sick. Okay? So, what is the three-step plan? We talked a little bit about what is green cleaning, why it's important, and what we can do about it, and we'll get to what we can do about it. But here's a three-step plan that I just really kind of suggest to get things moving in your organization with green cleaning. The first is align the workforce. Get them on board, right? Bring this up as an important item, an initiative that needs to be worked on, okay? And this is, I'll go into this a little bit more detail. The second piece is assessing the products, right? What products are we using within our facility, and are they? Let's assess them for true environmental soundness. Many times this isn't a learning experience for most people because they're not sure exactly if the products that are being used are appropriate and if they're safe. And then the last one is evaluate the practices. You know, what are we doing? What are the processes? What are the cleaning, audit our cleaning needs to match those against those areas where we need to improve. So, with first and foremost, it's about aligning the workforce, right? What would we say? It's about promoting stewardship. It's the ability to, you know, inform the staff and other departments that this is a good thing, you know, the benefits of green cleaning and why it's important. So awareness is key here. Maybe there's even the ability to consider awards to staff who have taken steps to exemplify green cleaning practices in action. You know, make it fun, make it part of some really positive efforts here to do really good things, not only for the environment, but for the people within the building as well. So there's opportunities, instilling new habits, some basic training regimens, and it can be really simple things that take place. The ability to look at less chemical usage allows us to say, hey, there's different ways that we can clean. There might be different approaches that we can take in order to need to use less chemicals. And then there's just check-ins ongoing to make sure that this is something that there's compliance and that it's working, that it's something that everyone is really embraced. So again, aligning the workforce and just gaining that awareness is really important as an initial first step. The second step of the three-step plan is about assessing the products, right? Now that everyone's on board, everyone is aware, let's take a look at some of the things, some of the decisions that we're making as owners and those responsible for the health and well-being of people that walk into a building, right? Raw materials, are the ones that we're using helpful? Are they renewable? Are they coming from good sources? Many of your suppliers can help understand this and help you provide that content. Does the product itself reduce health concerns? What is the VOC makeup on some of these? Are the cleaning agents that you're using all VOC free? Last thing we want to do is, in an effort to be cleaning, to make more VOCs within the building. Is the product manufactured using less energy and water? This really kind of goes back to that raw materials acquisition. The packaging that a lot of the product comes in, and again, there's 6 billion pounds of product that's there. That's a lot of packaging as well, and so that has a direct correlation. And then the distribution, is this something that's more locally sourced, or is this in transit from some location far away? So in an effort to clean green, are we having a truck that might be on the road longer than it needs to, and we might be going in the wrong direction from a carbon footprint there? So again, a couple real basic ways of thinking about some things here, but a couple others here, just reusing. Is this renewable? Does it have any sustainability benefits to it? And if it does, let's call that out, right? This is something that we also want to be proud of, give yourself some credit for. The operations side, does this product reduce health concerns? Maintenance, does this product manufacturer using less energy, less water? Does the product require less packaging from a disposal standpoint? So are there different applications per package that you can use? So there's a lot of options that are out here. And just looking at these things through the lens of green cleaning, I think will help allow your organization and your staff to start making those first, second, and third steps toward a more green solutions. Okay? The third step of the three-step plan, now that we've raised the awareness, we've got the staff aligned, we've aligned the products, and we've got a sense of the products that we're using, the processes, and now it's about the evaluation of the practices. So the equipment that we're using, consider how appropriate they use, how effective they are in usability. Are we still using the same sort of equipment that we've used in the last 20 years? Have we always used the same type of products as well? How about the procedures that we're using? Are they reducing the general health? Are they reducing the environmental impact? And again, relooking those procedures, making sure that we're not missing any key things, and taking into account those procedures from a green cleaning standpoint is absolutely key. The one thing that I will also then kind of call out here is, from a procedural standpoint, think about incorporating taking health and cleanliness to the next level. So right now, I'm certain that you are promoting hand hygiene with washing your hands. There's probably hand sanitization that's out there. Obviously, cleaning surfaces and high touch points like desks and doorknobs and things like that are key. But cleaning for health also means addressing airborne contaminants that can impact well-being. And so when we think about green cleaning, air maybe not come to mind, but it really should, right? Because what's in the air does get breathed in, and it also does land on surfaces, right? So it will help you, by cleaning the air, do a better job of not only just cleaning a clean environment, but there should be a tremendous amount of efficiencies and effectiveness of all of the current efforts you're doing with cleaning surfaces as well. So the bacteria, the allergens, the VOCs, and the odors all contribute to the removals of those all contribute to a very healthy environment. So the air is that kind of next level of cleaning and green cleaning that can take place. So for a truly clean facility, the recommendation and the idea that we want to pose here is to clean the air, right? The total clean solution includes clean surfaces and clean air together. They're so related. Think about it almost as the stool, right? You've got hand hygiene, you've got surfaces, and then you've got the third stool, which is the air, right? So that's something that is going to have a direct correlation on the health and well-being of the facility, in addition to the environment. To that end,
Jeff,
yes.
Jeff, I'm sorry, it's Ann Cosgrove. I'm sorry to break in, but we do have a poll to present to the audience before you move on. Sure, thanks. So yes, everyone, please look at the second poll that we have up there. What is your biggest indoor air quality concern? As Jeff was just talking about indoor air quality as part of that green cleaning plan. So please take a moment to read those choices and choose the one that's your biggest concern. Those are allergens and/or asthma triggers, germs and viruses, odor, sick building syndrome, or are you not all that concerned about air quality? Please take a moment. We will put up the results directly after. Okay, so what is your biggest indoor air quality concern here today? Let's see, almost half, germs and viruses at 49%, followed by 24% allergens and/or asthma triggers, and then sick building syndrome, odor, and most everyone is concerned about air quality. So thanks everyone for casting your vote. Jeff, back to you.
Great, thanks Ann for jumping in there. And I
Sure.
think that's really helpful, guys, is to really understand what is the concern. And you guys, you're already concerned about, germs and viruses and allergens and things like that, not only just in the air, but it's on surfaces. It's kind of the whole kind of total clean, total germ solution that you're looking to create, right? So in addressing indoor air quality, let's look to the government here and some of the guidelines that are here. And the Environmental Protection Agency, as it relates to indoor air quality, really has three main strategies. The first of which is remove. So let's say you've got asbestos, right? There's radon, fluorine. There's something really bad, that is within that's a source within your environment. The idea here is get rid of it, right? Remove, get rid of the source of the thing that's contaminating the air. The second kind of key area from a strategy standpoint is to vent. And that's happening today. If your building has HVAC, which I'm assuming 100% of your buildings do, this is all about diluting and adding more air to the environment to keep things ventilated, to keep airflow going, which is really all meant about agitating the air and moving the air around. So what's interesting about that, though, is it's moving around the quality of the air that's there. So if you have dirty air, or you have air that has viruses or allergens and germs, that part of it, your HVAC system is actually agitating that and moving dirty air around. So really the third strategy what the EPA recommends, which we're really emphasizing here, is about purification. It's purifying by removing the germs, allergens, and odors. So by removing those germs, allergens, and odors, it's also very complementary to your HVAC system, because now your HVAC system will be moving around healthy air. It'll be moving around clean air as opposed to air that has all of those germs, allergens, and odors associated with it, okay? So that's a way to think about it. Maybe to illustrate that point a bit more is how are viruses spread, right? So you've got an individual there on the left who is talking, sneezing, coughing, singing, whatever, yodeling. Any time that they're talking, they're emitting germs into the air. And so those larger germs or those medium to smaller germs, what they're doing, they're actually landing on surfaces, they're landing on the floor, they're landing on touch points, and they're landing on your hands, right, if you're sneezing into your hand or something like that. And so it's important that we continue to wash our surfaces and wash our hands because of that dynamic. The dynamic that is really being missed right now is the fact that when someone sneezes or coughs, really small nuclei in infectious droplets remain in the air, and they can actually stay suspended in the air for 6 hours or so. And they can actually travel a long ways away, and a lot of times being accelerated by an HVAC system. So that nuclei is actually so small that you're breathing it in, and it can bypass your natural human defense systems, and that's what gets you sick, right? So regardless of how many times you get the flu shot, and regardless of, if you're cleaning the surfaces, the flu shot itself can, last year was only 19% effective, but regardless of all that work, if you're cleaning surfaces and hands, if you're not cleaning the air, you're not really protecting yourself, because the airborne and infectious droplets stay suspended in the air. So to illustrate that, if I'm in one room and I sneeze and I'm contagious and I walk out, and someone walks into that conference room two hours later and just breathes that air, they become contaminated, they become sick, okay? The CDC has recognized this, the Centers for Disease Control, and they have actually stated, they've created a very clear statement that they put out there, that the air is actually more likely to transmit the flu virus than surfaces. And that's really interesting, because I think historically we've all kind of thought that, hey, I've just got to protect my hands and protect my surfaces and clean, and I'll be fine, right? Well, it's not the case. It's because you're more likely to breathe in the flu virus or to breathe in a cold than you are to touch something, okay? Interestingly enough, the cases of the flu over the last 15 years have not improved. And you would think that there would be a level of improvement given the knowledge we have, but the fact that it's not is interesting, and I believe it's directly because we are not cleaning the air, because that's where the infectious nuclei is. So cleaning for health, for me, it's all about catching the flu before they do, right? And so how do we make sure that as someone enters a room, or if someone does indeed come to work sick, that we can actually capture that influenza virus and remove that immediately? Staples, the office supply store, actually did a survey in the workplace, a workplace survey, and it was indicated that over 60% of people knowingly come into work sick, right? And I gotta be honest, I'm guilty of that as well, right? People are coming in sick because they got work to do, right? I got stuff to do. I gotta get moving. Maybe I don't trust the people who can take over my work, or maybe sometimes it's a badge of honor, right? I'm gonna be a good soldier and keep moving on. But definitely you want to stay away, because there's issues there. So air purification, what does it do? Is it removes rather than redistributes the vast majority of airborne pollutants, right? An HVAC system is designed to move air around, right? An air purifier is designed to take in air, run it through its filtration, and then give you purified air. Very similar to how you might think of water purification, right? You've got water coming through, your filtration removes all the impurities, so on the backside you're getting the pure water that it should be in its natural state. Same thing with air, right? The unit that we have here has actually been shown that we can catch 99.9% of the airborne influenza virus, right? What's interesting about this is if you capture the virus, air purification doesn't care what strand it is, right? The flu shot, they're guessing every year as to what the strand is and creating the right vaccination that way. But an air purifier, it just cares about what size. And the flue is always relatively the same size. So what's going to happen is, regardless of if what strand it is or if it mutates and things like that, it's just going to capture it down to that germ and virus level, right? The other thing to think about as it relates to cleaning the air is allergies and asthma. 1 in 5 people, so 20% of the people that are on this call right now, someone has some sort of allergy. And if you're someone who suffers from allergies, you know how miserable it can be and how unproductive you can be. What happens is, what do? You try to take a pill, right? You take a lot of the Clarinex and things like that. So rather than remove the allergens, the thing that's making you sick, we take a pill, which is obviously something we would like to avoid. The role of asthma rates in children is also increasing dramatically. It's certainly skyrocketing the amount of diagnoses that are taking place. So as you think about this, we've got a generation of kids who are coming through schools, who are coming through the workplace, who are now more sensitive to the air than ever before. And if you have asthma, you need to absolutely avoid any asthmatic triggers that can take place. And many things that I've talked about that are in the air are doing that. And those asthmatic triggers are happening because you're breathing in. So I also mentioned before the VOCs. There's VOCs in a lot of stuff: paints, printers and fax machines, composite wood. So if you've got some furniture that's been around for a while, probably a good chance that there's VOCs in that material. Older carpeting and linoleum, maybe even the fiberglass insulation that your building's made up of. And again, you can't detect it naturally. So whether or not you have it is an unknown and might be a problem. You don't even know it. So cleaning for health, let's talk about bathrooms, right? Bathrooms are the constant source of contaminant. It's one of the few rooms in a building where 100% of people go, and it's 100% of the time they're going there, and also they're going there 4, 5, 6 times a day, right? So what you have here is actually a computer model of what happens, and this is actually a women's restroom with 6 stalls. And if you're in a shared environment, my guess is that 99% of the time, the toilets in those areas don't have lids on them, right? And so what happens? So, when a toilet flushes what was in the toilet, there's going to be nuclei and things that come out of the toilet, and what you create here is a plume. Yes, it's a plume. A plume that comes out, and it makes its way in the stall, starts making its way outside the stall, and then the HVAC system agitates that so that it's throughout the whole environment, or a whole bathroom. So think about that. If you're entering, stalls soon after someone else is in there, you're breathing that air in. Now, when we take an AirMax and we put that over the stalls, or any air purifier is going to do a better job of capturing those types of contaminants that are being put in the air immediately. And not only is it going to be capturing the dirt, the virus, the germ, or the junk that's in the air, but it's going to immediately replace it with clean, purified air, right? So that's what's so important, especially in an environment like this, where there's a high degree of getting sick, right? There's a high degree of germs and bacteria and viruses making its way through because it's a bathroom, okay? Here's another kind of way to illustrate, virus and germs and how the impact that air purification can have. What this represents here is 0.3 microns. That's basically a size. That's called it's like a virus size, the size of a virus, so specifically like the flu. And so what this shows, this is actually measuring a fitness center within a hotel, and this shows that with every breath you're taking in about 25,000 particles at 0.3 microns. Some of that stuff can be fine. Some of that stuff might actually be an allergen, a flu, a bacteria, and things like that. Doesn't make you feel great, right? So what happens is when you add air purification, and in this case AirMax Professional, into this situation, the AirMax will clean the air and have a 70% reduction in airborne particles. So think about that. If there's a 70% reduction in the airborne particles all the way down to the virus size, that means 70% less flu, 70% less allergens, 70% less mold, 70% less virus that's in the air. That's a tremendous effort in being able to clean the air. And what's great about that is we haven't even used a chemical. You've done this naturally to being able to clean the air, and you're capturing it before it lands on a surface, before it lands on a high-touch area, right? And we've got a lot of experiences here. So Kimberly Thomas is an example here. She works at a school in Georgia and is a director of plant services and custodial operations. And she was saying, take a look at this, because what they saw was a significant decrease in airborne pollutants in the school and a marked improvement in indoor air quality. We've got many different instances in doctors' offices, in schools, in office spaces, things of that nature, where there's been an immediate drop of impact there. So being from AirMax, one of the ways that we look at this is we actually design a line of commercial air purifiers that are designed to remove allergens and viruses at 99.9% with a hospital-grade filter. It significantly reduces odors and volatile organic compounds. And the great thing about this is we know that as you're responsible for the health and well-being of the environment, you got limited resources. And so we built this with EnviroSmet technology, where this unit has sensors in it which automatically detects the occupancy of a room and also the VOC and the odor level, and it will increase and decrease its level accordingly. No need to manually turn things on or off. It's really set it and forget it. These purifiers go from 300 to 1,400 square feet, and what they'll do is they'll actually exchange the air, the volume of air, up to 5 times per hour. So in a room, the air will run through this an air purifier and be cleaned 5 times an hour at its highest. And so it does this by, first of all, capturing with 4-stage filtration. It captures the large particles and contaminants with a pre-filter. So this would be like the hair, the dander, and things like that. The carbon filtration, I talked earlier about VOCs and odors, right? This will naturally absorb, as the air runs through it, the carbon that's in here is naturally going to absorb that odor and the VOC. What's going to take away the viruses is the true HEPA filter, which is very much like what hospitals use to get down to the smallest level. And then also there's an optional ionizer, which gives you an extra level of protection of breaking down viruses and molds and things like that. So, we highly recommend green cleaning, not only with air purifiers, but doing so with air purifiers that are designed for commercial spaces, which are like shared spaces. And so AirMax Professional, there's 3 different kinds here, which are really designed to customize for your space. So if you've got a smaller office, examination room, a smaller environment, the AirMax 2 goes up to about 300 square feet, and it's only about 4 inches off the wall. The AirMax 3 and the 4, if you've got bigger spaces, these can go up to 1,400 square feet in total. As I mentioned before, it's got some nice green cleaning elements to it, because not only are you cleaning the air, but you're doing it with 0 use of chemicals. Each one of these units is very efficient from an environment standpoint. About less than $10, the smaller one is $10 to $11 to $12 of cost of your electricity. So very efficient. It's 24/7 constant air cleaning. So this is your staff member who's always cleaning the air and knowing when to clean it. And to that end, less airborne dust, less germs means less surface cleaning that needs to take place. And so that's a way to reduce the amount of chemicals, reduce man hours, things of that nature. So with that, I hope I was able to kind of highlight for you, why green cleaning is important and what it is. The 3-step program on exactly how to go about start implementing green cleaning, getting your staff involved, being able to kind of assess your products and then put together new processes. And then the last piece there of being able to say, hey, you know what, there's this new idea and new level of cleaning that maybe I'm not thinking about today, and that's about cleaning the air. And because the air has such a direct correlation to the health and well-being of others. So thinking about it, back to how the quality of water, the quality of food, the quality of air, we certainly need to be thinking about as well. So with that, I'd like to thank you for your time and open it up for questions.
Thanks, Jeff. Thank you very much for the presentation, and to all our attendees for listening in. We'll have a couple questions that we will, let's go through these for a moment. Okay, I do have one for you, Jeff. Does placement of the unit matter? For instance, if there's an area with printers or copiers, you had mentioned that in terms of a source for VOCs. Does placement of the unit matter? Should it be closer to the copiers? Or is it okay if it's across the room? Does that impact effectiveness?
Yeah, great question. Generally, we're always going to say that you want to be closest to the point of contamination, right? So as I illustrated, like in the bathroom, for example, these are designed to be on a wall, so it can be close to the source of contaminant. So it's over the stalls. That's the ideal place so that you can get that as quickly as possible. So to capture it at its quickest point. However, as I also mentioned, that AirMax exchanges the air 5 times within an hour. So let's say that just based on the structure of your facility, that you can't get it right next to the copier. The fact that you're in the room and going to be exchanging the air in that room anywhere from 2 to 5 times an hour, it's still going to be extremely effective. So the closest you can get is key, but know that if you can't, you're still going to be extremely effective because of the amount of times that you're going to be exchanging the air.
Great, thank you. And then we do actually have 2 questions coming in about maintenance and filter changes. So I'll phrase it this way. What does the maintenance entail for any or all of these units? For instance, what kind of filter changes, what is the frequency and the cost of those as well?
Yeah, absolutely. Very good question. We design these in a way to minimize how much time you need to spend with them. That's why we've got the sensors in here, which will automatically increase its performance and decrease it, so you don't have to turn it on or off. And with the same, we put the same thoughtfulness in with the filter life. So we put extra levels of filtration in here, so that on the HEPA filter, you have to change it only once a year. And on the carbon, that might be 6 months. So it's kind of like, think about the same way of changing your batteries in your smoke detector. So it's not something that has to be done daily, weekly, monthly at all. It's once to twice a year.
Thank you. And is there a battery operated model? How do these work?
Yeah, no battery operated model. These are all electric. The units that are up on the wall can be tapped in from a hardwire standpoint. It's very easy kind of connection, very common. Usually you have someone on staff that'll be able to do that. We also have some stand models, and the stand models can be plugged directly into a standard outlet.
Thank you. Let's see, and then we'll just switch gears a moment and talk about actually measuring the air quality. You had noted, for instance, the hotel example. I think it was a fitness center you mentioned.
Yep.
So can you just talk, and the reduction in the particles that were found. So can you just talk about how a facilities person, or how you work with your clients to understand what their quality was before, and then what the impact might have been with one of your units?
Yeah, absolutely. I mean, and we find that's a very common request because many times, an organization or a client wants to be able to show others within their organization, the improvements that are being made, because it's an awesome story. So what we'll do is we've got kind of air quality experts in different regions, and we're very happy to come to your location and do that exact same measurement. We'll measure the amount of particles that are in the air, and then we can also show you the improvement that takes place when we've got AirMax turned on. And that's hugely motivating. It shows you in your environment, at what levels that you're operating at and how much improvement you can indeed make. So if you're interested in that, certainly reach out directly to me, and I can get you connected with the right people here. And it's a really good conversation that you can have, and something that we happily provide to people that are interested.
Great, thank you, Jeff. And I think we have one more question here, and it actually talks about residential. So we'll go for it here. Is there a residential version, or would the AirMax 2 be suitable to be used in a 4-room home, for example? Is that a fit, or would you recommend that?
Yeah, I mean, overall, we get that a lot too, because many people, if you got allergies at work, and you got them at home too, right? So, these are certainly designed for commercial environments and in large spaces. These can absolutely be used in a residential space as well. You certainly can be purchased and used in the same way that you could use it in a commercial environment as well. These are designed to perform at a superior level to some of the, I would say, cheap plastic versions that are out there, that you might find for $89 somewhere. You're not going to get the level of cleanliness that you're really needing. So these are kind of commercial grade standards, and like the same way you might have a commercial oven, you could certainly incorporate this into residential.
Thank you. So one last question. Actually, this is more of a housekeeping piece. Wondering if you can post your contact information. I don't know if that was on your last slide, so that we can, so that the asker can obtain more information and pricing. If not,
Yeah,
obviously you could read it out.
yeah, absolutely. Well, two ways to go about that. If you go to AirMax Pro, that website that's listed right there, you can actually, there's a place where you can request some information, and that will certainly make it directly to me. The other way that you might want to, if you want to get in contact with me directly, my email is D as in David, RY, F as in Frank, HOU, at fellows, FELLOWES.com. So jdreifhout at fellows.com, and be happy to get in touch.
All right, thank you. Thanks, Jeff. With that, we'll wrap it up. Thanks for the presentation.
Great, thanks everyone.
And thank you to AirMax Professional for sponsoring the webinar, and of course our audience for attending and for sending in your questions. A recording of the webinar will be available online for your reference at facilityexecutive.com, as well as at the AirMax Professional website at airmaxpro.com. Thank you very much. Have a great afternoon. Bye-bye.